we will talk about probiotic interventions for prevention of complications when you are taking antibiotics. I have created a session for you to learn what you can do when you are taking antibiotics to minimize the risk of complications and long-term consequences. My name is Dragana Skokovic-Sunjic. I'm a clinical pharmacist and I'm author of the Clinical Guide to Probiotic Product, available in Canada and in US, that will help you navigate and decide when you need probiotic, and if you do, which one would have most benefit. This tool is researched, updated annually, peer-reviewed, and evidence-based. Free access. Antibiotics are amazing medication, and they have been life-saving medications ever since we discovered them. What the action of antibiotics is that they will kill bacteria, and quite often bacteria can cause problems, can cause disease, complications, can actually kill us if we don't treat it appropriately. And since the discovery of first antibiotics, we were very happy. We were using them to kill bacteria, to heal and cure patients. But we also have discovered that bacteria we are trying to kill can very quickly learn how to become resistant and not respond to antibiotics. This is why we have developed new and more antibiotics over the last 100 years. We discovered what we call the first generation, second generation, then precision antibiotics, trying to kind of hone our ammunition against pathogens, against bacteria invading our body and causing infections. What we have done in a part and parcel of killing good bacteria and clearing infections, we managed to kill good bacteria, those kind of innocent bystanders that live in our body and provide us with health benefits. So that's what we've been doing with antibiotics as well, quite often killing good guys as well as bad guys. So certain infections, some of the most common are the upper respiratory tract infections, ear and sinus infections. They are quite often caused by virus, and they could be self-limiting. We do supportive therapy. We make sure that you have no pain, no inflammation, give you something for runny nose, maybe for cough, make sure you're hydrated, and your body will actually clear the infection on its own. There's no need to use antibiotics for those infections. However, often those infections can develop and open the pathways to bacteria to take hold and cause more complications like pneumonia or bronchitis or more resistant sinus infections. And for those infections, we need antibiotics to treat them. Also, quite often, we might get soft tissue infections if you get injury or cut or something that is to do with the skin and soft tissue. And those infections are quite often pathogen getting in and causing the inflammation, swelling, wounds not healing properly. Those need very specific and very quick acting antibiotics. Then there are more serious infections that we get after maybe surgical procedure, or infections such as tuberculosis or other kind of infections that do definitely need antibiotics. And that is done and decided with your healthcare professional, with your physician, that will actually prescribe antibiotics for you for the specific reason and for specific amount of time needed to clear the infection. So when you are ever prescribed an antibiotic for yourself or for your child or for your loved ones, the prescription clearly states what to take for how long, how many times per day. Few things we have to remember is that we have to take it as prescribed. If it's something that is for 7 days or 2 weeks, we need to follow and take it for the full amount of time not discontinuing after they start feeling somewhat better. So that's number one. Second thing is thinking back the last time you took antibiotics. Did you have any issues? Did you have any complications? Did you develop diarrhea after taking antibiotics, or in women, yeast infections or other complications? Those patients will be great candidates to take preventative therapy to minimize the risk of side effects of antibiotics. In addition to that, if you are elderly, immunocompromised, young child, very sick with the infection, you might consider taking probiotics to minimize the risk of side effects of antibiotics. One of the common side effects of antibiotics is antibiotic-associated diarrhea. So when you think about it, you already have infection, you're not feeling yourself, you probably waited for some time to see the doctor. Now you're finally getting the antibiotic prescription to clear the infection that already has affected your body, your eating habits, your nutrition status, and your hydration status. Now you're getting medication that will clear the infection, but at the same time can cause more complications, more diarrhea, more risk of dehydration and complications. So we think about steps we can take to minimize those problems. So when taking antibiotics, you have to first speak with your pharmacist that is dispensing the antibiotic and get specific recommendations about maybe some restrictions or food suggestions with that specific antibiotics. Some of the antibiotics need to be taken with food because they can cause stomach irritation. Some antibiotics need to be taken on an empty stomach because then food might impair the absorption of antibiotic. Specific antibiotics cannot be taken with a calcium-containing foods such as dairy products, etc. So each antibiotic is very specific on how to be taken. That's number one. Second thing, most of the antibiotics can kill and will kill good bacteria in your gut, increasing your risk of complications and side effects of antibiotics. And we have sufficient evidence to recommend and suggest very strongly to our patients to be proactive and take a probiotic, a specific proven probiotic, to minimize the risk of complications with antibiotics. In addition, there are preliminary evidence and lots of research looking into using probiotics to actually help the effect of antibiotics. So what I'm saying that in a research, they found out if we give a probiotic, a specific kind, along with antibiotic, we actually allow antibiotic to work better at the site where it should be working. So we augment the effect of antibiotic, we clear the infection faster, and we minimize the risk of complications. There are different kinds of guidelines globally, and they can be confusing from country to country, from continent to continent, from association to association. So the bottom line from our research with the Alliance for Education on Probiotics and working with global experts in this field is the recommendation is very strong that patients should consider selecting appropriate probiotic and taking it during and shortly after they finish the treatment with antibiotics. So when selecting or deciding to take a probiotic along with antibiotic, there are a few points to remember. At this point of time, even we have so much initially and for the longest time, we've been telling patients to take the probiotic at least 2 hours apart from taking antibiotic dose. This is not based on a hard science. It's a bit of an empirical advice we give just to be on a safe side. This might change in time with the more research being done. I can tell you there is preliminary research ongoing right now, giving a probiotic along in the same tablet and capsule with antibiotics, showing great evidence. So we don't really know yet about timing. And to be on the safe side, we are telling everybody to take it 2 hours apart. That's number one. When selecting which probiotic to take, there's really no specific pairing of antibiotic and probiotic. So we know that antibiotic action is a class action of medication. They are killing bacteria, period. They should be killing bacteria. And probiotics are known to minimize the side effects, and there are different kinds. There are probiotics that are based on yeast, on Saccharomyces, for example. They might be more resistant to antibiotic action, so that's an option. And the product containing specific yeast are listed in the clinical guide to probiotics. But there are also probiotic combinations having single strain of probiotic or combination of strains of probiotics that have great evidence to minimize the side effects of antibiotic and improve the outcomes. Some specific probiotics have been shown very effective to minimize the risk of the very severe complications of antibiotics, which is C. difficile infection or C. diff. And some hospitals have that specific probiotic combination in their formulary. That means that actually giving it to patients that are very sick, needing antibiotics to minimize the risk of C. difficile infection, which is very common in hospital with very ill patients. So C. difficile infection or C. diff, you probably hear in the news, which is Clostridium difficile, is bacteria that most of us actually have in our gut. It's a kind of a dormant, sleeping bacteria that does not do much in our gut. But given the opportunity, for example, given the time when antibiotic is killing all the good guys in our gut along with the bad guys, that dormant pathogen can actually wake up and wreak a real havoc in our gut. It can cause very severe diarrhea that is associated with ulcers inside the bowel. Patients that get this severe C. difficile infection usually end up in a hospital on specific treatment protocols, and quite often patients that are elderly or compromised might die from this particular complication. So preventing it's best bet, best option we have. And quite often we do that with specific probiotics when are given with antibiotic treatment for other issues and reasons. And the list of those probiotics with good evidence is in the clinical guide to probiotic products.